So I'm Elliot Stackhouse. I'm from a company called iMEDicare. So I'm the national sales manager for the company. And what I've come to do today is a nice little workshop looking at CAUTI Reduction, with the main emphasis on looking at external continence products for men and women to offer an alternative to a catheter. So it's nice and exciting. It's a good little topic. So a little bit about iMEDicare. So a rapidly growing medical device distributor established in 2004 by Darren Breen, who's sat in the audience. And what we specialise in is continence and sort of continence management and continence treatment devices, but also andrology products within the urology field. Now we have 11 reps that are dotted around the UK, and we serve the hospitals really well through education and also through patient understanding of products also. So we pride ourselves on three main values, and that's for educating clinicians, making them aware of what the options are and how they can access them. We like to pride ourselves on improving patient care by bringing world-class products to the UK market. And most of all, with the urinary management products, we're looking to improve urine output and management. So urinary continence affects everybody in the world at some point. But we know that it affects any age and gender. The bladder and bowel community estimate 12 million people in the UK will experience some sort of urinary leakage. And catheterisation is the common procedure which is undertaken by a lot of healthcare professionals, but it's not simple or risk-free. And the Health Economics Research Unit estimate around about 15 to 25% of patients admitted to NHS hospitals every year will require a catheter. And approximately 5% of those patients will experience bacteriuria. So what are the reasons for inserting a catheter? So perhaps the patient has an enlarged prostate, like BPH. They might be looking to provide comfort for perhaps those who are clinically ill. Perhaps they don't have wounds that are healing, perhaps like pressure sores and pressure injuries. Measurement of urinary output for those critically ill patients, especially in ICU in that setting. Urodynamic testing, imaging studies of the urinary tract, and also to deliver medication for those patients with bladder cancer, for instance. So what is a CAUTI, otherwise known as catheter-associated urinary tract infection? It is one of the most common healthcare-associated infections caused by bacteria entering the urinary tract via a catheter. But what are the causes of it? So prolonged catheter use, improper catheter insertion or maintenance, bacterial colonisation, and contaminated drainage systems which affect that closed loop. Now, the symptoms of CAUTI can affect people in various ways, but we know that patients can experience a fever and chills. The urine can be cloudy, strong smelling. There's often blood in the urine itself. There's often a burning sensation or discomfort in the bladder or lower abdomen, and the increased urgency or frequency of the urination. Of course, if they're catheterized, they may not experience those issues. And obviously confusion and delirium. And that's why we do find that a lot of elderly patients on elderly wards do contract a CAUTI infection, which then allows for them to deteriorate a lot faster. So why is CAUTI a main concern in healthcare? So we understand that it's increased mobility and mortality, prolonged hospital stays and increased cost. The antibiotic resistance and overuse is really problematic, regulatory and compliance issues, and then most of all the burden to healthcare staff and resources. So things to consider. What is the type of catheter that's in situ? Can it be removed? The patient should be reviewed over that period that the catheter is inserted. Is there a genuine clinical need for catheterization? And the patient should be reviewed regularly in that instance. Catheters should be removed as soon as practical, or perhaps when the patient's condition allows. So urinary catheter complications. So I imagine we've all seen patients with catheters, and they're not simple or risk-free in that instance. So we know that they can result in bladder spasms, leakage and bypassing, and blockages, expulsion, and then most of all, infection. So CAUTI is one of the most common preventable healthcare-associated infections within the hospital setting. And we know that 40% of all healthcare-associated infections are linked to catheters. Oh dear. And it makes a major challenge for the patient safety. Between 12 and 16% of hospitalised patients require an indwelling catheter at some point in their period in the hospital. And up to 25% of hospitalised patients receive a urinary catheter, and half of them may not need it in the first place. So we know that CAUTI develops when bacteria enters the urinary tract, and the risk of infection increases by 5% every day that catheter is in place. We know that obviously as the catheter is in place, that then progress into a bloodstream infection, which can then lead to sepsis and unfortunately death as a long-term avenue. Now, the reasons for a catheter to be inserted, so the NHS developed a model called the Houdini model. Just like the magician, we're looking to make it disappear. So they utilise a standardisation protocol, which looks at like a flow chart, allowing them to ask the questions in the most appropriate manners to the right people, to then hopefully mean that that catheter can be reduced in the dependence and the need for it. So some of the tips down here, like remove it post-operatively after 24 hours. Perhaps if they've had like hip surgery or they've had spinal anaesthetic and things like that, it's viewing and asking the questions at the right time. Using an antiseptic non-touch technique when inserting the catheter. Use a smaller size catheter as possible. But then also, when you look at like the end of life, could that patient be utilising a non-invasive option as a good option? So this is a gruesome image. So thankfully you've not had lunch yet. So when we look at sort of urine pooling against the skin, it can often cause an element of irritation, which then allows for skin breakdown and then necrosis. So this is an image which is a patient who utilises a urinary sheath, but often if they're not sized correctly, the urine can pool at the end of the penis, which then causes incontinence-associated skin damage, pressure injuries, and then moisture-associated skin damage. Often, moisture-associated skin damage is often when patients are sat in that wetness against the skin, such as like disposable pads. But there's no indication for inserting a Foley catheter if these wounds are there. There are other options out there that can be more effective. So the solutions. So at iMEDicare, we have two fantastic options in the form of UriCap and Men's Liberty. So UriCap is a non-invasive option for a female, which is very similar to a sheath, but it works completely externally for a woman. Now, it's quite exciting because there's been nothing in the female side in this way that's been non-invasive. At the minute, women only really have pads and catheters, but offering a non-invasive option is fantastic. Men's Liberty is a petal sheath system, which is one size fits all, which is much easier to use than a convene sheath or other sheaths out there on the market. So why this succeeds, so both devices are designed to minimize skin contact, preserve integrity, and to ensure patient comfort, reliably diverting the urine unidirectionally into the bag, which significantly reduces the CAUTI instances and allows for accurate volume measurement. So what do we do in that situation where a patient has a buried penis or a smaller anatomy? So patients with like class 3 obesity will find that they have excess fat around the abdomen, which then buries the penis a little bit. And then lymphedema is a big aspect for those patients with a lot of swelling around the pelvic area. And then patients who have chronic erectile dysfunction, obviously with chronic erectile dysfunction, they have a thing called non-use atrophy, which allows the penile tissue to shrink, which can then affect like urinating, standing up, and other factors. And this is often a big consideration for patients who are on hormone therapy for prostate cancer and other factors. So the limitations of the current Foley alternatives for men. So we have condom catheters and we have disposable pads. So condom catheters, they tend to fall off easily. There's a number of different sizes. Trying to get the right size is quite difficult. Some people are often a little bit larger in the morning than they are in the afternoon, with a good old morning glory and things. But the key thing is that they are time consuming to apply, and the patient has to be completely dry for it to work effectively. But also, they can be quite painful on removal in the context that the pubic hair can get caught in the stickiness. And then we go on to disposable pads. There's a number of different sizes. In the NHS, often patients are on big, bulky pads, but it's nice to sort of quantify what the pads are, and maybe that pad could be a smaller pad in the longer term. But also, the skin breakdown if they're not changed regularly with that skin contact. So finally, an external catheter that works. So this is Men's Liberty Acute. Everyone says it always looks like a flower, which it does, so flower power all the way. But it's one size fits all for men, for circumcised and uncircumcised. It's comfortable, it's a secure leak-proof design which improves the patient's dignity and keeps the skin completely dry. Now, the main factor is that it can last on the skin for between 24 to 48 hours, whereas often with sheaths you might find yourself changing the patient a couple of times a day, which obviously is a big upheaval for the patient because you then have to keep checking them and then put a new one on. But it's been proven to reduce catheter days by 19%. So the way that we place the device on, another penis image, which it'll carry on all the way through. But the way that we place it on, the penis stays completely dry. We then put the wipe on, we let it dry there for 30 seconds, and then we put the faceplate on, and this vent here faces upwards. So naturally what we allow for airflow as the patient urinates through the tube, but we then put a secure wrapper on the outside. Now often trying to make sure that the patient is completely dry as you are fitting these appliances is quite difficult. So what we always suggest is if you get your finger and thumb and you pinch the base of the penis just to compromise the urethra for a short amount of time, that allows for no urine flow to come out the end. But we can also use a small clamp just to place it at the bottom for that short period. But we also have the ability to attach that onto any night bag or leg bag as well. So the previous image was Men's Liberty Acute. They are fantastic for patients who are bedbound in that instance. And then this product here is the Men's Liberty. So this is comprised with a 240ml bag that's pre-attached. So really good for those patients in that rehabilitation setting when you're trying to get them up on the feet. They're not going to trip over the leg bags or the night bags. But also it means they have that independence that when the relatives come around, they don't see them having a bag in place. We can also connect a larger bag at the end through the drainage plug. But both of these are available on GP prescription as well in the UK, as well as being accessible on NHS supply chain. So Men's Liberty has been shown to reduce Foley catheter rates by 19%, as previously mentioned. And the average wear time in the study was 24 hours. But we noted there was no complications and no adverse effects or CAUTI instances in this time period. And this was looking at a 16-month study, 107 beds in a long-term acute care facility in America. So this is a very interesting initiative. So this is a poster which was published in 2017, but it looked at the avenue of quality improvement as a nurse-instigated initiative. So what this showed was there was a nurse in a hospital in Chicago who was looking at trying to create a bit more awareness on external continence devices and then create a bit more of a pathway of education to make people aware of what the options are. And I think that's the big value to take away from this, because ideally education is fundamental for understanding what products for wear and which products are suitable for certain people. But this quality improvement initiative was implemented in November 2014, hospital-wide for 60 days to determine the impact of external continence devices, in particular Men's Liberty. And the 60-day comparison of CAUTI rates was made before, during and after the quality improvement initiative to determine the effectiveness of that intervention. Now the intervention, a novel of Men's Liberty as we'll put it, was utilised instead of an indwelling urinary catheter in patients who met the following inclusion criteria. So no restraints, no BPH, no neurogenic bladder, cooperative with no urinary issues, and then hospitalised for 2 weeks or greater. But the key factor is the education. So staff received education on the appropriate application of the male or Men's Liberty, and the trainer programme was implemented to ensure staff competency and also knowledge of the anticipated wear time. And it was important that the nurses who were implementing knew when to change the products as well. So what they found that CAUTI rates fell to 0 during the 60 days implementation of the product, which is fantastic as an initiative, and it should be something that we can maybe carry over into the NHS practice as well. Because trainer is a big factor. I know in the UK we have some fantastic clinical educators, which are great in their jobs. But it's good to be able to know what those patients can see just by having the guidance, really. So what this showed was the use of Men's Liberty can successfully reduce urinary incontinence in circumstances where indwelling catheters are deemed inappropriate, and then ensuring the appropriateness criteria are adhered to for urinary catheterization is essential for the prevention of that CAUTI infection. So the independent product evaluation is always good to hear how patients do get on. So the biggest factor of this is we know that 72.8% of patients would advocate the use of Men's Liberty. and 59.1% of patients found it was easy to apply. But having that fundamental panel of speaking to patients and understanding what their views are is really positive to take things forward. But in that hospital setting, it will typically be the nurses that apply it, but the nurses say very, very similar in that respect, and they find it a lot easier to apply because not having to fight with different size of sheaths, and also the compliance is much better. So again, the products are on FP10, so GPs in the UK can prescribe them, which is fantastic. So the next product is Uricap. So Uricap is very similar to the compound of like a contact lens, so it's a really soft medical graded silicone. It doesn't require any suction, there's no glue, there's no tape, so it's a really, really non-invasive option. It's disposable, single use, and it's comfortable for up to 24 hours of use, but it's fantastic for that 24-hour period, but also really good for that 24-hour period, but it's also really good for urine specimen collection for those patients who you are getting contaminated samples repeatedly, which means you can get them on the right antibiotics a lot earlier on in that instance. So how does it work? So it makes a change from a penis image, which is good. Uricap fits over the urethra, but it uses natural surface adhesion, very similar to like putting two panes of glass together where you have that surface contact. And the labial folds then come back over just to position it in the correct place. Now, every time the patient voids urine, because of the temperature change, it moves closer to the surface, so it improves that contact point a lot more consistently. Now, the clinical studies, so we have 4 studies as a whole. The recent one between 2023 and 2028 is still data collection, but we can show that in 2017, the feasibility study looked at 3 nursing homes, 30 female participants who utilised the product for 756 nights. And they found there were no adverse effects. The urine, all urine in the bag was down to surface adhesion. There's no vacuum in play, but it showed the product was effective. But what they did find were they had to adapt the product a little bit on the actual design of the product to make it more of a shoe shape. So then the longer aspect stayed in position a lot better, rather than when it was the first generation was more circular. So that allowed them to move on to 2019 with the new generation, which is the one we have today, which looks at 2 hospitals, 14 participants with 149 Uricap applications, and the continuous use was 30 days. And that showed the design modified to increase further softness of the device, which improved usability and prolongation. The extension tube itself was also a lot softer in the study as well, because what they were finding were, because the tubing was a little bit harder, as they pulled back the duvet, sometimes it became dislodged. So the longer tube and the softer tube is much better. But the added securement device, the leg, improved that success when they were pulling the duvet across. Now in 2020, this is quite an exciting aspect, where they were looking at utilising Uricap for an MSU collection. And they found that 28 out of 29 samples collected weren't contaminated. As we know, the contamination rate with women, especially in the elderly setting, can be up to sort of 30%. But the good thing is that because we are taking it from the outside, well, from the urethra itself externally, it reduces that cross-contamination with the labial folds, which means the catch is much cleaner. But it offers a low-risk alternative for sampling to avoid that intermittent self-catheter. So when we look at the waste difference, so Americans always love representing things in buildings. So if we look at like a 5-story apartment building in comparison to that of pads, when you look at the grander picture and how much we can save in waste, so we look at the one value with regards to the 5-story building of Uricap in comparison to 38 pads. And we understand that pads take 7 years to decompose, but then you also have the added element of microplastics and things like that further on. So Uricap is the new and safe way in sampling urine with a low contamination rate. The great thing is that it's soft and comfortable. Patients can place it on themselves. And it offers a new way of replacing invasive catheters or beakers for urine sampling because it can be taken directly from a clean bag. So then the addition, so we know there's a low rate of contamination compared to midstream urine collection. The external and clean procedure is no risk of causing UTIs. It's really easy to apply in an A&E setting, pre-surgery or perhaps an outpatient clinic. It can be used on all women when the uncontaminated sample is of importance and can stay on if the patient can't get in out of bed and wants to stay dry. And I think that's the big factor, because we find that sleep is a big part of these patients' recovery. And if you have someone who sleeps a lot better, then they're going to recover a lot better. But obviously, hydration element is a big consideration as well. But this is a really nice testimonial from a nurse in Israel who found that UriCap was fantastic, provides an excellent, reliable and safe solution as an alternative to that of catheters. But when there's a need to collect urine for culture, both in the internal department and the general emergency department, UriCap, the use of UriCap female external catheter, they were very satisfied. So UriCap have a fantastic training resource portal, which we can happily introduce you to in your departments. And it allows for you to then cascade the information across the whole hospital, as in through fitting and also application of where they should be placing it for the right people. Obviously, with this, it's important that they are picking the right people. You want someone who is bedbound with low mobility. If people are moving around too much, then it will slip off the urethra and you won't have that positive contact point. Both products, Men's Liberty and UriCap, are available on NHS supply chain. So they can be ordered directly through the hospital. They come in either boxes of 10 or boxes of 30. So sustainability and long-term benefits. So reduced healthcare costs, implementing non-invasive alternatives like UriCap and Men's Liberty lead to fewer infections, reduce hospital stays, and then furthermore saving NHS resources. The eco-friendly approach, by having fewer infections, the decreased use of antibiotics and disposable materials, promote environmentally sustainable healthcare, which everyone is channeling towards in that avenue. Improve patient outcomes, lower quality rates, enhance patient satisfaction, and then support NHS priorities. So sustainability, a focus area of industry and public health. So we understand that high volumes and large environmental impacts, such as like over-consuming antibiotics, build then a resistance to that antibiotic threshold. And then transportation of large volumes, such as pads and briefs, allow for fuel on the roads. Storage of large volumes in sort of the hospital stock rooms and other factors. Incineration, 50% of all pads will use like boiling water and other factors. And then leakage of urine into the ground can cause over-fertilization. But we know that both products, Men's Liberty and UriCap, have that added value of reducing that weight and waste, really. So the conclusion. So embracing non-invasive solutions, the key takeaways. Non-invasive devices like UriCap and Men's Liberty reduce infection risk, improve patient outcomes, and lower costs. And the call to action to all of you guys is just to prioritize non-invasive options when appropriate, to then have that view of sustainable healthcare, really. And then just to end on this, so reducing CAUTI and protecting the immunocompromised patients will then in return free up hospital beds. And it's something that we have hopefully got in process. We are trying to get UriCap on prescription in the community, which will hopefully mean that we can get it into the community, which means that they can do UTI assessments in care homes and things like that, you see.